Welcome to Hemp Sisters Nation, where you don't need a reservation. I said, Mama, hello, stand with open arms. Here to warn you with the one more time. Yeah, one more time, baby. Welcome to the nation. I said, welcome to the nation.
What do we know what the fuck's lurking about? We don't know anything. It's been lied to our entire life.
But you know what is reality? We're back and having a show
The
today.
Hemp Sisters.
Hemp Sisters
Back
are
and
here.
better than before.
In flesh.
The flesh.
We're well
With our new
pinned.
pins.
I was like, we're well pinned.
What do our pins say?
All right, yours says do no harm, but take no shit.
That's me. That's my
That's
mask.
right. Then I got the tea.
Spill it. Spill it.
Because I like to meme a lot.
It's true.
Mm-hmm.
It makes me laugh in my sad times.
It's sad times. Aw,
They're
it's
long
sad
behind
times.
us. Now we're only happy times.
Yeah, no, I have been sick for some time.
Yeah.
About 3 weeks now.
Yeah, this is literally the first time we've gotten together in weeks.
It's true.
So good evening.
And welcome to the Hempy Hour.
Sorry it's been a while, guys. It is not intentional. We love and miss you.
It's
We
true.
appreciate you. But you know what? 2022 has been a little bit of a rocky road so far.
Good start. It was a good start.
Incredible.
Yeah,
Yeah,
it's
not a
actually
bad
good.
rocky, just up, down,
Just
left, right.
good.
We're all over the place. Yeah.
Yes. You know, there's like some personal obstacles to like hurdle over.
Yeah.
Hurdle.
Hurdle. Let's just
Hurdle,
get
hurdle.
right over them.
Hurdle over.
However you have to do it.
However you have to
You
do
get
it.
over it. Is what
Get
you
over
do.
it.
Yeah.
Yeah, so it's nice. I haven't been at the beach here
Oh, let's turn
for
that
some
off.
moment.
Sorry you guys had to hear that. How
Aw.
terribly inappropriate. Whilst recording.
Whilst.
Okay. So what have we been doing these last few weeks? You've been hitting up the healthcare industry.
I have been.
I have this crazy hair everywhere.
Wow, it's got its own land.
Unnecessary. Wow, look at it.
It's got its own
Look at it
agenda.
go. Okay.
Look at it go. Oh no, it's there. It's because you have curly hair and it's on a root.
It's like, listen, stop fighting it.
Yeah. I wish I
It's
had
wild
curly
and
hair.
free.
I don't have it.
Why are we haven't talked about anything. It's been like 10
We haven't
minutes.
like
Okay, hi.
literally. I know.
We're just babbling and babbling.
Because we haven't been able to hang out.
2022, the Hempy Hour. I personally, this past week or so ago, 1 week ago, got certified in cell phone journalism. So we're working, and the Hempy Hour now is part of a global community, and we do.
Oh, you have that on my screen share.
Yeah, we're doing a little unbiased reporting. Different countries are involved. I'm on a team where I think we represent 15 different countries, all kinds of beautiful languages spoken and people just allowed to be people. We are a judge-free zone. We just let you bring us some stories and we open our minds and we listen to them.
There we are for New Year.
Yeah, so right there was our New Year's, and we're just getting started. So we're going to share a little health and wellness with them. The Hemp Sisters are going to be like the health and wellness portion.
Reporting on health and wellness.
Health,
Yeah.
wellness, yeah. And going hand in hand with that, and very exciting new adventure.
Here.
Yes, Health 6 Fits.
What is Health 6 Fits?
Guys, it is the key to health 24/7 without leaving your home, and answers you didn't even know you needed. Like this, the universe has opened up to us, guys. This fell into our lap. It's everything, me specifically, it's everything I've ever learned about my entire life, health and wellness. And, God forbid we don't jump right to, modern medicine and big pharma, and we see what works with our bodies and, try a little natural route and see where that takes us.
I'm from the outside. It's really interesting to me to see companies in this framework, this particular measure of time doing this, and not only doing it, but like doubling down to make it a lifestyle habit.
I like that you said lifestyle. That's it. You're not stopping by once in a blue moon. You're
No.
daily for your stress test
Right.
and your hormone test and
Yeah.
your genetic testing. And
we really have to get back in that, while we have loosely advanced healthcare, concepts and ways of life, like that doesn't poo-poo other options.
Yeah, long before there was Western
Our
medicine.
humanity, you know what I'm saying? I mean,
Yeah.
so it's really cool to see that and then see it kind of in a modernized way,
Yes.
something that people can like embrace and walk into, without, so it's not archaic, it's not old school, it's not shamanic like that, where
No,
it has an
right.
annotation of being not effective to a lot
Right,
of people. But
right.
this is more of a modernization of it.
And it's beautiful.
And it's
like, look at this. Like, I've never stopped in a website and been
Yeah.
like, oh, that's really nice.
No,
Like, it's
right.
beautiful.
No, it's really cool. It's interactive. I know this
Yeah,
is
so-
kind of in
yeah,
a
well,
beta.
right,
but,
right.
But yeah, checking in for if you're already a member. And then would you like to go into new member registration?
Very cool. Yes,
Yeah.
yes, yes.
And there's a video here.
Yes, and Paul Epstein, guys, the CEO of H6Fit. This is his love child. He has done this for decades of his life and has an incredible story of his own. He's got a little 7-minute video here that we'd like to play for you guys because it's an incredible story and one of a lot of people can relate to. I mean, I myself was misdiagnosed for years with a problem that probably could have been helped years before.
Right.
I mean, no one knew what the heck was wrong. So he has a very similar story on, this road of playing in the Western medicine world and where that may or may not lead you.
Yeah. Yeah. And in your case, again, it's like not asking the right questions.
Right.
Oh, here we go.
Let's
Let's
meet
meet
Paul.
Oops, yeah. All right.
Welcome to Health 6 Fit. You're about to enjoy the most unique health, wellness, and fitness experience in an exceptional, first of its kind virtual environment that has been personalized for you. Health 6 Fit is where you can explore wellness in a surroundings that is an escape, a healthy place to be, a feel-good, immersive virtual retreat. Health 6 Fit is the future of healthcare reimagined today. Health 6 Fit is a peaceful, relaxing, and inviting place to visit. Our personal well care team is here to guide you on your health journey in every way. They will show you how to de-stress in 5 easy steps. You will learn simple, helpful nutritional tips and techniques from nutrition experts around the world. You'll be able to exercise in your own virtual gym, experience professional pharmaceutical grade supplements, learn about hormone balance and how it applies to you in ways that once you understand the importance of using biometric diagnostics that will keep you healthy. This is not your ordinary website. In fact,
We talk about stress being like a huge factor of
Health 6 Fit is a
causing
resort.
hormonal imbalances.
It's a
That
retreat.
is the kind of underlying reason of why it affects our
Good
health.
reason, as you will see as you
So
become
cool.
a member. Hi, my name is Paul Epstein, and I'm the CEO of Health 6 Fit. In today's world, you want to make sure you prevent the ravages of diseases like COVID. You want to build your immunity and reduce the effects of or the potential effects of chronic disease and illness. If you have a chronic disease, we'll do our best to help you manage and potentially reverse it. You're going to have to do the work, but we're here to help you. Or if you are healthy, we will help you stay that
Yeah,
way.
because the
And
pharmaceutical man was
lower
like, just
your
take this pill and then
healthcare
just hope
costs
you
by
pass. Like, you don't really do much else.
via the first ever
It's
unique
like enabling.
6-step health process. I myself have struggled with a chronic disease, a heart condition that started at age 34, and not one doctor would believe me, thinking that it was only stress. I was extremely athletic, took good care of myself, and so my doctors thought that I was healthy. By 54, I found a doctor who listened, and I learned that I had a 90% blockage in the main artery. They fixed it, but all those years of misdiagnosis caused other issues. The doctor told me there was nothing more that he could do, just enjoy whatever few years I had left. When I asked him what I could do, he said I should just eat right and keep fit, and he knew nothing about how to do that, but I should be lucky to live another 8 more years. I went straight home to my computer. It took 2 hard years searching Dr. Google's myths versus facts. and I made 3 started with discovery. One, while 30% of all disease is genetic, 68% is due to lifestyle factors and biochemical deficiencies. 2, I learned about lifestyle medicine and how it can guide you to the root cause of disease. 3, I sought out an expert physician who knew lifestyle medicine, but I also realized there aren't very many who practice that. When I did find one, I quickly learned that my hormones were indeed out of balance, so I fixed that. But it was beyond that. I liked sugar,
He takes HGH.
so I had to learn how to deal with it.
Oh, really?
Yeah,
I
but
also
I think
realized
it's
that I needed to overhaul my diet and get rid of processed foods. I learned I needed to exercise
never
more
really do.
effectively. I also learned that the supplements I was taking lacked quality. I had to learn how to deal with my stress. Today, we need that more than ever. And most important, I had to learn how to understand biological diagnostics so that I could understand it better than any doctor,
Mm.
for good reason. I learned how to do all of these things the same way that you can and you will. Within weeks of following my own advice and what I learned, I felt better for the first time in years. My friends noticed and asked me what I was doing. They asked for my help to resolve their issues. I did research. I referred them to physicians with specialties for the help they needed. They all experienced great results. I realized this was my calling. And now I'm here to help you too. We will help you every step of the way. That's my plan. So how did I come to this point? I recognize this as a mission to help others solve their immunity, chronic disease issues with solutions that already exist. I invested years and my own money to research how to deliver self-care at a reasonable low cost. I'm proud to say that with a team of dedicated professionals, physicians, academicians, health coaches, and other professionals, we created a stunning lifestyle self-care solution. Health 6 Fit is an economical way to build your immunity, reverse the effects of chronic disease, and even prevent it. As you will see, our low-cost annual membership provides you with the most advanced tools and services, such as a health risk assessment, which we found to be the best available. It tracks your lifestyle activities, stress, nutrition, fitness, body composition, and much more. We use this information to help you personalize your Health 6 Fit health and wellness plan. You will then experience our WellCare team support, where you will explore weekly, step-by-step guidance to healthy living through your courses and webinars by top-tier medical and health professionals with insider information. You'll be able to access an online health and wellness helpline. We also provide you with an online live forum and community. You'll even find me. We negotiate and pass along the lowest price for pharmaceutical grade supplements, products, services, and diagnostics. You get low cost fees if you need a physician and other services such as telehealth, wearables, medical devices. And there are many other benefits too numerous to mention. In developing your personal treatment plan, we combine the best of science evidence-based lifestyle self-care solutions that are designed to simplify your day-to-day. Health 6 Fit puts you at the center of your health. When you join our innovative health and wellness membership, you have a voice and a choice via our large support community. This is the healthcare opportunity you have been waiting for. Being a member in Health 6 Fit will deliver tremendous benefits at an economical cost. We're ready to prove everything we claim. Thank you, and to your help.
He's the sweetest guy ever. I swear to God. That's awesome.
Oh my gosh, guys. First of all, I'm so glad you got to meet Paul. I've never met someone and within a week just fell in love with them. Like,
No,
This-
she's never done that.
never in my
ever.
life. This woman has known me since, the day she was born. Okay, never.
It took
It's
me like 30 years to get in pocket. I'm just saying.
yeah, I mean, it just, when you click, you click. When you find your tribe, when you're in with the right people, you feel it. You don't
When
just
you
think
ask
it.
the universe for your path.
I
universe
manifested
delivers.
Paul.
Yeah,
There he
you
came.
manifested it.
Yeah.
Yeah.
Guys, so H6
Mhm.
Fit, I mean, there is no end to where this business model is going. It can branch off into, as you heard, a million different directions. Never before has there been a virtual one-stop shop for, alternative healthcare. Yeah, I've never seen anything like this. I've never heard of anything like this.
Yeah.
I don't know. I'm excited. We're going to have Paul on as soon as we can. The next few weeks, we'll have Paul on and
Mhm.
really answer some questions. So, I'm going to do a couple polls on LinkedIn and see what you guys really want to know and what you want out of a health and wellness service, and make sure we're covering all of it.
Mhm.
I mean, what
What's
do you
your
think,
most-
Lo?
yeah,
Someone
what's
from a
your-
healthcare, like Lo's in
Yeah.
healthcare now. She's working in health insurance and Medicare.
We were loosely talking about it because, there is a place for, I hate using the word alternative.
I know,
health,
the original
but we
health.
have to,
Right.
define them in some manner, But I mean, again, there is a place for that in healthcare, validity, again, we are constantly stuck in this situation. Here's my epiphany since I was sick the last couple of weeks.
Yeah.
I thought about it and I thought, when I'm listening to all these things like, sure, not, don't care, people overflowing hospitals and all that stuff.
Mm.
And I thought about it and I thought, yeah, they probably are doing that because they are so ill confidenced on how to manage their health that hearing that they have something that's kind of exotic, and and maybe is so frightening that they don't even understand the little things they can do for their own health and their
Well,
wellness.
fear makes you do crazy shit.
Yeah,
I mean, you experience this with your ex-husband. Her
Yeah.
daughter will get the sniffles and he's like, we're in the emergency room. And she's like, what the
He's
hell are
so
you doing?
right,
Abort.
yeah.
Just.
No, and it put me in a weird spot. Like that one time that he did do that with her, and like I called him, like he doesn't have jurisdiction over things. They were going to give her a drug they give to people that have cancer. She was 7, and she had a tummy ache, and she was nauseated. And they said, "Well, our job is to make her feel better." I'm like, "Your job is to use common sense. I have a child that has no."
Do you have any ginger ale handy?
Yeah, she has no symptoms. She hasn't failed a test. Like she just, she's. It's behavioral, we were having that problem with her dad and stuff, trying to get his attention. Like you give her anything, and I mean, that was like flying from Wisconsin. You give her anything,
Right?
But again, a good example where he was in a panic, he didn't know what to do, and he had no confidence that he could do something.
Right.
He didn't know like what's the defining line here. When do I need an emergency situation?
Right.
So I thought about that, and then just to kind of pick into why this is something again, and you use that word like you are the center of your health. You are in control of that,
Right.
and we often forget that because we've kind of traded that for a false sense of security that we're going to live when we walk into these places because they know what's best.
Right. And then we just blindly trust
we
our
don't.
mind, body, and soul with a stranger. Like
That
no
doesn't
more.
know about us, we did,
There's better ways.
Yeah.
And there's other ways. And there's no reason not to try. No one's saying don't go to your doctor. We're not saying don't call your doctor and don't consult your
No.
doctor. It's the opposite. You should do all of that. And you should let him know about H6 Fit. And you should let him know about this, virtual health and wellness center that you get to test your stress levels every day. And, when your diabetes is off, you have a professional that you can consult with on the spot. And you don't have to make an appointment in 2 weeks that you may or may not be able to see your doctor. It's immediate. And it's to relieve your mind. And now you're not on WebMD or like Paul said, Dr. Google at your service.
Yeah.
Guys, we're flooded with misinformation. We've been lied to since before we were born, so we have to be able to sort through a lot of information and make some decisions for ourselves. Learn, research, educate yourselves, and make good decisions for you and your family.
And you have to, we have to stop looking at other people to solve our problems. Because this is why we don't have doctors on board with alternative methods of healing, is because every time they make a decision outside of what protocol would be, like they're losing their licenses, they're going to be malpracticed against.
Right.
And that's because we're demanding that of them. They're like, to make us live forever. We have to get better.
Yes.
We have to get better at what we demand from the healthcare system.
Yes.
This is like a striving force of what is happening right now. We're demanding that something happen. We want to feel safer. It's putting us in bad positions where people are doing terrible things against our freedoms,
Right.
our life, to try to not get sued, to try to not be a social pariah, you know? I mean, again, I hear the argument with like vaccine passports and vaccine cards going to restaurants. You are going to just willingly give somebody information about you that has no training.
The
doesn't understand
17-year-old
medical.
hostess is the one letting you know whether you can eat or not.
I mean, I'm
is
offended
where
by
we're at,
that.
guys.
I'm
This is
offended
where
by
we're at.
that. Then you feel safe with that. That's the bigger problem. You feel like you entered something safe because somebody completely untrained doesn't, you know what I mean, have anything about medical care, couldn't even authenticate that if they wanted to. You know, I go there with someone with a crayon and a couple boxes. It's completely nonsensical because it's not, you know, but you feel safer. You feel safer
Somehow.
to do that. Go fuck yourself. Sorry. I'll come back.
You need to turn your TV off. Is the problem.
You need to turn your TV
All
on.
right, we've run amok.
Damn it.
But H6 Fit, it like is. It's true though. We're passionate, guys. We're passionate because you know we've seen it all, and we're closing. I'm closing in on 50. I'll be 49 this year. Lowe's hitting 45. Like we've seen some shit.
Okay,
You know,
I am.
the age doesn't matter. It's frame of mind. But we've seen some shit. We were Gen X. You know what I mean? We lived through some shit. We drank from the hose. We lived. You know, there were no cell phones. There was no internet, and we learned how to communicate and solve problems, and we did it all. And I could probably count on one hand the amount of times I was in a doctor my whole life. Like we didn't run to the doctor for everything. We ate well and we slept and drank water and
we had and we still hold it, a real core feeling of our responsibility with what happens in our
it's
lives.
on us. It's not to my neighbor
what I mean?
how I'm doing today, or the guy across the street, or you know, old lady Sally hasn't gotten her 12th booster, so now I'm gonna get sick today. Like, no, Sally, it's not true.
Yeah.
You know, so we need to get a grip. We need to come back together as humans and remember that we're in charge of ourselves, and let's make some good decisions in the process.
Yeah, and people that are in our healthcare are our partners in our health.
Yes,
You know,
it's
so
open communication.
So again, I
Should
really
be.
like the idea that they have with, you know, a lot of the biological diagnostics.
Functional integrated therapeutics.
Mhm.
Fit.
Right, because we are completely different on the inside.
Sure are.
We have totally different responses to things, and what may help me is death to you.
Right, no, for sure. And I mean, Paul and I'm picking Paul's brain like crazy now. You know, I lost my father. He was only 54 years old, quadruple bypass by 42. My genetics are complete shit on both sides. But you know, that little, his little tidbit about that only being 32% of me, and I'm in charge of the rest. You know, sure, I got some shit that I have to deal with, but you make good decisions and you become health conscious and you decide what's best for you, and you ride that lifestyle out for as long as you're here.
Right.
We don't know, and tomorrow's not promised. We don't know. Let's make some good choices.
Not even a little bit.
Let's be nice. Let's just talk about that for a minute.
So don't tell people to fuck you.
I mean,
Sorry,
not
it's been
all
a
the
minute.
time.
No,
Sometimes
it's
you
fine.
deserve a fuck you, but you
Usually
know what? I
times.
mean, like, there's too much like, what did you say? I believe this. And if you don't believe what I believe, then like you said, fuck you. Or you know what I mean? Who cares? Who cares? What happened to everyone's different, and that's okay. And can't we all just get along? And that's how we were raised. Everyone, differences of opinion are welcomed. You know, let's talk about that. That's exciting to me. You know, but now I'm an asshole for it. Like, what just happened? It's confusing. And we want our life back.
Right.
We don't want the new this or the new that. Or no, I like how it was, and I like that. Let's just be humans and talk and be adults and get along.
Yeah.
Can we do that, guys?
Is it a small ask or a big ask?
Can we do it together?
At the very least, we can agree that you have choices,
Yeah.
and that nobody can take that from you.
Only if you let them.
It's true.
Mass non-compliance.
Yeah, right.
Oh, sorry. Woo! I'll get a little taken away
A
there.
little doctor. A little doctor. Hi.
Guys, sorry, we don't want to take too much of your time today because we wanted to touch on a few different things. And, you know, we
Yeah.
got some health and wellness episodes coming up. We're going to have some awesome interviews with some professionals and really teach you guys some stuff. So
Stuff.
yeah, we'll put some links in. Make sure you're subscribed to everything that we're doing, and
Mhm.
make sure you have an opportunity to join H6 Fit, which is $55 a year. So literally, you know, change 15 cents a day
Mhm.
for health. I mean, you know, $1 a week. Try and find an excuse. You know, it's there aren't any.
Yeah.
There aren't any.
There aren't any,
There
you
aren't.
know, yeah. If you're watching this, you're in an age group where you're like, what have I done the last 20 years?
Right. And how do I want the rest of my days to be spent?
Right.
Do I want to be in pain? Do I want, you know, chronic inflammation? Do I want stress and anxiety, or do I want to just breathe and live and enjoy every day and feel grateful and blessed and
learn how to get out of it. We're going to feel
Yes.
that we're human, but
Oh, of course.
understanding how
It's up to us.
to get us out of that, move forward, grow, be healthy through the process.
Yes.
Cope, I guess is the word,
Yes.
coping.
And get along.
Yeah.
Get along. We're all together. We're all one.
Yeah.
We are. So
We're
whether
back.
we're back.
We're back.
Whether you are watching us or listening to us, we appreciate you. And again, reach out with any questions, any concerns. We'll get some links in there so you can start learning about H6 Fit. And we're going to get this into your life this year, guys, because you need it. You might not know you need it.
What was the
You need
website?
it.
Oh yeah, we'll put a website links and everything. in
Yeah, we'll make
there,
sure you guys get
LinkedIn
everything.
Profiles, get following in the group.
Yeah. And let's start just talking. Let's have some discussions, ask some questions, and let's get you some answers, and let's get you on the road to health. One love.
Bye.
It's happening. Welcome to the nation. I said, welcome to the nation.